How does the CEA tumor marker test work for colon cancer? Have you ever wondered how doctors monitor colon cancer? One important tool they use is the carcinoembryonic antigen test, commonly known as the CEA tumor marker test. This test measures the level of CEA, a glycoprotein that is typically found in embryonic tissue. In adults, higher levels of CEA can suggest the presence of colorectal cancer or other types of cancer. However, it is essential to note that this test is not used for initial diagnosis or general cancer screening. So, how does it work? CEA is produced by cells in the large bowel and certain tumors, including those associated with colon cancer. When a tumor is present, it often releases more CEA into the bloodstream, leading to elevated levels. However, elevated CEA levels can also occur in benign conditions such as inflammation, liver disease, or even in smokers. This means that while elevated CEA levels can indicate cancer, they are not specific to it. In clinical practice, doctors typically measure CEA levels before starting treatment. This establishes a baseline level for comparison. After surgical removal of the tumor, CEA levels usually return to normal within 1 to 6 weeks if the cancer has been completely removed. If CEA levels remain as high or increase after treatment, this may suggest that there is residual disease or a recurrence of cancer. Therefore, regular monitoring of CEA levels every few months is recommended for patients who have been treated for colon cancer. This helps detect any relapse early. The sensitivity of the CEA test varies depending on the stage of cancer. In early-stage colon cancer, the test may show low sensitivity, meaning only a small percentage of patients will have elevated CEA levels. However, as the disease progresses to more advanced stages, the sensitivity increases. For instance, a majority of patients with stage 4 colon cancer will likely have elevated levels. It is important to remember that, due to its limited sensitivity and specificity, the CEA test is not suitable for screening the general population for colon cancer. Instead, it serves as a valuable tool for monitoring known cases and assessing treatment effectiveness. In summary, the CEA tumor marker test detects elevated levels of the CEA protein in the blood, which can correlate with the presence and burden of colon cancer. However, interpreting these results requires careful consideration of clinical findings and other diagnostic tests. Always consult healthcare professionals for personalized medical advice and to understand what these results mean for your health.